Welcome to the video answers for question set 16. Let's get started. First question, the dorsal root ganglion is considered gray matter within the spinal cord. From what embryological derivative are the dorsal root ganglia derived? So the dorsal root ganglia are derived from the neural crest, which is derived from ectoderm. Now in part 2 of the course, we're going to go over which parts of the body are derived from endoderm, and which ones are from mesoderm, and which ones are from ectoderm. That's actually very, very important for step 1 in your level 1 exam, so it wouldn't be a bad idea to start familiarizing yourself with this now while you have a little time. And you also need to know which ectodermal structures come from the neural crest, such as the dorsal root ganglia. Next, at what positive g-force does visual blackout occur, and why does this occur? So this is another one of these environmental medicine questions that isn't covered in most Step 1 review books, like decompression sickness we talked about in an earlier question set. So visual blackout occurs at 4 to 6 Gs because the G-forces are basically pooling blood into the abdomen and the legs. There's not enough blood being returned to the heart, and there's insufficient perfusion of the brain. Next, which complement protein is an opsonin? So an opsonin is a molecule that binds to antigen so that it can be phagocytosed and taken out of commission. Now there are a lot of different opsonins, but the two main ones are IgG and C3b. So the answer here, the complement portion, is C3b. And then which complement protein aids in neutrophil chemotaxis? That's C5a. And which complement proteins form the membrane attack complex? So you can think of the membrane attack complex like assembling a gun. You have all these different pieces to put together. There's C5b, C6, C7, C8, and C9, all these different complement components. Then they get inserted into the plasma membrane one at a time until there's this big hole in the membrane that disrupts the cell's ability to maintain homeostasis, so the cell dies. Next, a 40-year-old woman treated with lisinopril for stage 1 hypertension becomes pregnant. Why are ACE inhibitors contraindicated in pregnancy? So ACE inhibitors like lisinopril and also angiotensin receptor blockers like losartan are teratogenic. So in the first trimester, they can cause cardiac and CNS malformations. And then in the second and third trimesters, they can cause renal problems in the fetus. So the next part of the question says, what centrally acting alpha-2 agonist is often used to treat hypertension in pregnancy? This is methyldopa. Next, an elderly patient fell and struck his head on a coffee table. His family brought him to the emergency room. He's currently conscious and at his neurological baseline. Non-contrast CT of the head reveals a crescent-shaped radiopacity that follows the contour of the skull crossing suture lines. What type of an intracranial hemorrhage might this be, and which vessels would be involved? So a crescent-shaped radiopacity which crosses suture lines is a buzzword for a subdural hematoma. The most common vessels involved in a subdural are the bridging veins. Next, a 42-year-old obese man presents with a complaint of severe pain in his right knee. He believes he injured it while dancing at his cousin's wedding last night, but you suspect gout. How do you differentiate between gout and pseudogout on examination of synovial fluid aspirate? So with gout, the joint fluid has urate crystals, which are needle-shaped crystals, and they're negatively birefringent, so they're going to look yellow under parallel light. And then in pseudogout, these are calcium pyrophosphate crystals, and they're rhomboid-shaped, and they're positively birefringent, so they're blue under parallel light, and they look yellow under perpendicular light. Next, a child presents with nephritis, deafness, and ocular dysfunction. What's the diagnosis? So this is a classic triad of Alport syndrome. The mnemonic for this is can't see, can't pee, can't hear me. And be sure you can recognize that presentation. The next part of the question says, a gene defect in what type of collagen contributes to the dysfunctions associated with this syndrome? So Alport syndrome is a defect in type 4 collagen, which makes up the basement membranes or the basal lamina. And then what type of collagen organizes the bone, skin, and tendons? That's type 1 collagen. And what type of collagen organizes cartilage? That's primarily type 2 collagen. Next, where is most of the CSF generated, and what's the function of CSF? So most of the CSF is formed in the choroid plexuses of the 2 lateral ventricles in the brain. And then the functions of CSF are to suspend the brain, so it's kind of floating in CSF, which helps prevent forces like gravity from distorting the brain. It bathes the neurons and glial cells in a homeostatic medium so that the body can tightly regulate the pH and electrolyte concentrations and such. And the CSF also provides a route through which certain chemical messengers can be widely distributed in the nervous system. Next, what's the composition of a nucleosome? So the nucleosome is a basic packaging unit of DNA. And that DNA is wound twice around a core of histone proteins. There are the histones H2A, H2B, H3, and H4, and you have 2 of each of those for a total of 8 individual histone proteins in that core, and then the DNA wraps around the core. An important thing to know about histones is that they're designed to bind to negatively charged DNA by having an abundance of the positively charged amino acids lysine and arginine. And then which histone ties nucleosomes together? That's histone H1. Next, a child is noticed to be yellow by a visiting relative, so he was brought to the clinic. His exam revealed jaundice and splenomegaly. The patient's lab results reveal anemia and spherocytes. What test is used to confirm the diagnosis of hereditary spherocytosis? So hereditary spherocytosis is a condition where there's a defect in one of the red cell cytoskeleton proteins, like spectrin, band 3, protein 4.2, or ankyrin. So when these proteins are defective, the red cell won't have its normal disc shape. It's going to form sort of a spherical shape, which is why we call those cells spherocytes. So the diagnostic test for hereditary spherocytosis is called the osmotic fragility test, which is where you put the patient's red cells in a series of increasingly hypotonic solutions, and those spherocytes are going to lyse more readily than a normal red cell would. And then what findings are associated with hereditary spherocytosis? So the red cells are microcytic, and they're round, and they have no central pallor. There's increased mean corpuscular hemoglobin and increased RDW. The spleen then recognizes these cells as abnormal and takes them out of circulation, so you're going to have extravascular hemolysis. Coombs test is negative because Coombs test is a test for antibody-mediated hemolysis. And then other features of hereditary spherocytosis include splenomegaly, gallstones, and aplastic crises with any kind of stress, especially after parvovirus B19 infection. So, that's the end of set 16. I'll see you next time.